I realized that, neuroscience itself is just such a broad and vast area, and in the healthcare system, it's very much underserved. And part of that is just a lack of understanding of really how, our brains are working. But now, we're at this time period where there's this convergence of advances in hardware, in microelectronics, et cetera, and now in software and our ability to analyze that data. And so putting those two things together, I'm really, really excited about, bringing along the next generation of companies that are really going to help us solve and tackle the challenges that have endured for many, many years in things like neurodegeneration, and psychiatric disorders. It's impacts so many people globally and has such a high level of economic burden. We need to be able to advance these therapies, and that's really what drives me. I'm also really interested in, the extensions of all the things that are being innovated and pushed forward by the demands in healthcare in our society, but also how they're going to influence the future of technology just for healthy consumers broadly, right? In a few years' time, we may see a lot more neurotechnology, in everyone's hands, and it's part of our everyday lives.
I think, similar to you, the future could be really monitoring brain health in a sense. Sometimes I think about the Fitbit of the brain, type of thing. And maybe not everyone's gonna have an implant, right? But how do you think about how we use that to then, better determine dementia, or to your point about mental health? I think that's a hugely underserved, topic. And I think it's gaining momentum in our society, but still that whole mental health feels like it's a big gap that no one's really solving besides, I'll go see a therapist, We
need to start talking about mental health. And so first of all, getting over that broad stigma about that actually has only happened in recent years. Now that people are really starting to pay attention to that and really value that as part of a desirable lifestyle, to take care of themselves in that way, and monitor how they're feeling and reacting to things, and understand their behavior, and understand that there's a biological reasoning behind that. I think that's going to have a tremendous impact on the types of technologies that we see, the types of things that are pushed out into the commercial realm. And it's just a really exciting time period to be able to contribute to that. Well, the brain touches everything, right? And we're seeing some really interesting studies about how neural activity can really be influenced and also influence in this bi-directional manner of, your immune system, obviously at this conference we've been talking a lot about chronic pain, and mobility. It touches so many different things, and it extends itself into a lot of different markets. And I think being able to democratize the understanding of how that works is also part of this process and creation of a market that will continue to foster new innovations.
Yeah, and I think it's actually a really good point on the understanding piece, right? Because I think about what Dr. Asheron said yesterday on neurostimulators, everyone goes and gets back surgery, but not everyone. Once you're you're going to implant a stimulator, which, back surgery, you still get implants, right? But you're going to get a stimulator, patients don't want it. And so how do we, part of it's the patient education and getting them to come along the journey, not just the clinical stakeholders where companies have traditionally been focused.
Right, absolutely.
And maybe kind of one other question. So being a female, right? I've heard, I am not a female founder, but I've heard from other female colleagues who talk about fundraising as a female can be really hard. Going through kind of setting up your own kind of venture capital, kind of what advice would you have to either a female founder or other female kind of co-founders of funds to kind of start this, or kind of what advice would you give to them? 2023
was a tough economic year for many founders, for many people looking to raise capital at all stages, right? And I look back on my path, and I know that I've built a tough skin, being not just a woman PhD in a STEM field, but also a woman leader in finance and venture capital, where it's easy to stand out in a room when in both of those areas, and really combining that, and starting a investment platform and a venture fund that focuses specifically on neurotechnology. It's an endeavor that you have to learn very quickly. You need to adapt. You need to stay resilient, and you have to always be open to learning and taking the things that you learn and applying them in a very agile manner. And I figure out how to ask the right questions. Reach out to people. Networking is super important, but also sometimes you just really got to just manifest. When you stand for something, hopefully that will attract the right people towards you who want to work with you and who want to be supportive. And I think that's having the right energy and the right mindset is a critical aspect, because you have to endure the marathon and be careful of not burning out, and also managing a number of different tasks all at once. So, but I would be, I'm hopeful that what I'm doing can also help inspire other people, men and women, to be able to achieve their dreams.
So you said you work a lot with early stage founders, and you also mentioned even from your patent, law time that sometimes founders can have difficulty articulating value propositions. What are the things that you're most interested in seeing from them when they kind of put together their pitch decks?
My background really lends itself to being able to understand a lot of the deep technology, a lot of the data, and the IP. So I do actually look for strong data sets in the materials. Now, there is a right way to present that information, right? So you want to figure out what your key metrics are, and you want to be able to tell that narrative in a way that makes sense, and really back up the fact that, okay, if we're developing a particular product, for example, tell me why this particular component or part of your intellectual property actually lends itself to becoming competitive in the marketplace. And really connecting all of the dots and tying all of those things together is really a critical aspect of that I look for in a founder's ability to tell that story. And if it's something that's more of like a therapeutic asset, for example, I've seen a few that are coming through doing drug discovery for Alzheimer's or other kinds of diseases. And so, on that, I want to be able to see, data that backs that up. So part of what makes a good quality data set is like, what are your controls? Like, how many patients or animals were tested? Like, I think that's something that we need to know. They're statistically relevant, and how was the data normalized? How were the subjects selected? So I think there's all these different pieces that go into my mind when I'm evaluating something, and oftentimes the science part and the technology part is what these early stage companies are starting to become built around. After that, then we start looking more at the business model and seeing, okay, is there a viable company that can be built around this that can scale? And what would be the budget and timelines related to get that to their next milestones? And another critical aspect when it comes to neuromodulation devices or is really an understanding of the FDA and the reimbursement pathways that they would need to navigate through over the next few years. It's a longer timeline, of course, and many things may change in the legislation over time, and a lot of discussions are happening right now. But I want to be able to, tell that the team is really thinking about that and is making choices early on that will lend themselves to going down, leveraging as much of the resources available as possible to be ready for those, for crossing those bridges when it's time.